You ever like scroll through endless health articles online and just feel more confused than when you started?
Oh, definitely. Yeah.
Like you just wish someone would cut through all that noise and tell you what actually matters for your well-being.
That feeling of being overwhelmed by health info. I hear that all the time. It's really tough to know where to put your energy.
Totally. Well, that's exactly what we're digging into today.
Hmm.
We're focusing on something really fundamental, preventative care.
Hmm.
And we've got some interesting material to work with. There are insights from the Suprematic Healthcare Investment Collaboration that looks at the big picture, like healthcare systems, funding, the infrastructure side.
Yeah, the system level. And it's fascinating to pair that with the core of our discussion today, which really comes from Dr. Surtarem Vishnoy's work, excerpts from The Essentials of Preventative Healthcare, and also the Lifelines by Suprematic material.
Right.
So one source is talking about building the hospitals and systems, and Dr. Vishnoy is focused squarely on, well, how you can proactively stay healthy. It's quite a neat link, actually.
It really is. So our mission for this deep dive, we want to pull out the most important stuff about preventative care from these sources, make it super clear, give you things you can actually do, and help you figure out how to weave it into your life without, feeling like it's this massive, impossible task.
Sounds good.
Okay, so let's start right there. Based on these sources, when we say preventative care, what are we actually talking about? What's the definition?
Well, at its core, preventative care, according to the materials, is really about the actions you take to prevent illnesses, injuries, diseases before they happen.
Before they happen. Okay.
Dr. Vishnoy really stresses this proactive idea. It's a shift away from just waiting for something to go wrong and then, reacting to it.
So it's not just calling the doctor when you feel sick. It's the stuff you do when you actually feel fine.
Exactly. It's about being intentional when you're healthy.
Can you give us some concrete examples from the sources? What does that look like day to day or year to year?
Sure. The sources consistently bring up routine health screenings. That's a big one. Things like getting your blood pressure checked, regularly. Or monitoring cholesterol levels. Vaccinations are another really clear example protecting against infectious diseases.
Right, jabs.
Yeah. And then there's that whole big category of healthy lifestyle choices. What you eat, how much you move, how you handle stress. All of that is absolutely crucial preventative care.
Okay, so it's the annual checkup, sure, but it's just as much about, say, grabbing fruit instead of chips or going for a walk. It sounds like it's a very integrated approach.
That's a great way to put it. It is integrated. It covers both the medical side, the checkups, the tests, and our daily habits. That's a key point Dr. Vishnoy makes.
Holistic, almost.
Precisely. And understanding that connection, how the medical stuff and your personal choices work together, that's really key to getting why preventative care is so valuable.
Okay, that makes sense. We know what it is now. Let's shift to the why. Why should this be a priority for us? What's the big payoff?
Oh, the sources make a really powerful case here. A standout point is the statistic that a huge chunk of chronic diseases, we're talking heart disease, type 2 diabetes, even some cancers, are largely preventable.
Wow, largely preventable. That's huge.
It really is. When you think about the impact those conditions have on people's lives, knowing you can significantly reduce your risk is, well, it's a strong motivator.
Absolutely. So it's not just about feeling a bit better each day. It's about potentially avoiding some really serious health problems later on.
Exactly. And a big part of how that works is early detection. The sources really hammer this home.
Okay.
Those regular screenings we mentioned, blood pressure, cholesterol, cancer screenings, they can catch diseases really early, often when they're much easier to treat.
Right.
And catching things early can make a massive difference. It can slow down the disease, sometimes even stop it from progressing, and just generally lead to much better treatment outcomes.
That makes perfect sense. Find it early, deal with it better. The example used, like finding breast cancer early through mammograms leading to more effective treatment, that really illustrates it, doesn't it?
It really does. It's a very clear example. And the benefits aren't just about avoiding or managing illness better. There's more.
Oh, like what?
Well, preventative care often leads to a better overall quality of life. Simple as that.
How so?
When you're actively taking care of yourself, eating well, exercising, managing stress, you just tend to have more energy, maybe feel sharper mentally, a greater sense of just well-being.
Yeah, I can see that.
Plus, the sources also mention a long-term benefit that usually gets people's attention, potentially lower healthcare costs down the line.
The money aspect.
Right. I mean, think about it. If you manage your blood pressure through diet and exercise now, maybe you avoid needing expensive medications or hospital visits later. It's an investment.
An investment in your future health and your wallet. I like that framing.
hmm And Dr. Vishnoi even brings in that classic Benjamin Franklin quote, an ounce of prevention is worth a pound of cure.
A classic for a reason.
Exactly. It just perfectly sums up the value proposition, both health-wise and, yeah, economically.
Okay, sold on the why. It's clearly important. So let's get down to the nitty-gritty, the how. How do we actually do preventative care? The sources, especially Dr. Vishnoi's stuff, seem to offer a clear roadmap.
Yes, Dr. Vishnoi lays out what he calls the 5 pillars of preventative healthcare, which is a really helpful way to break it down. Pillar number 1 is regular checkups.
Okay, the annual physical. Even if you feel totally fine, why is that still so important? What's happening there?
Good question. Because even if you feel fine, these checkups let your doctor track your health metrics over time, blood pressure, weight, maybe blood sugar. It helps establish what's normal for you.
Establishing a baseline.
Exactly. So it's easier to spot small changes that might signal something developing early on. Plus, it's your chance to update your medical history, ask questions, raise any concerns. It's that key touch point.
Got it. Building that health picture over time. What's pillar number 2?
Pillar 2 is screenings and tests. Now, this is related to checkups, but it's more about specific tests based on your age, your sex, your personal risk factors.
Okay, so more targeted.
Right. The sources mention things like cholesterol checks, often starting in your 20s, various cancer screenings like mammograms, colonoscopies, blood sugar tests if you're at risk for diabetes, bone density scans later on. Even regular eye and dental exams are part of this.
Wow, that's quite a list. How do you know which ones you actually need? It feels like it could get overwhelming fast.
It could, yeah. And that's where the sources really highlight talking to your doctor. It's crucial.
Okay.
Your provider can look at your family history, your lifestyle, your age, all that, and recommend the specific screenings that make the most sense for you, and importantly, how often you need them. It's not one size fits all.
That's good to hear. It's personalized. So a conversation, not just a checklist. What's pillar 3?
Pillar 3 is vaccinations. And the sources make a point that this isn't just for kids. Adults need to stay current, too.
Right. Easy to forget about adult vaccines.
Very easy. Key ones mentioned are the annual flu shot, making sure your tetanus booster is up to date. That's every 10 years. And then vaccines for things like pneumonia and shingles, especially for older adults. And the HPV vaccine is also recommended for many adults, up to age 45.
Okay, good reminders. And the sources mentioned kind of double benefit with vaccines, didn't they? Protects you, protects others.
Exactly. It's individual protection, but it's also community protection, herd immunity, essentially. You reduce your risk and you help stop the spread to people who might be more vulnerable. It's a win-win.
Makes sense.
Yeah.
Okay, pillar number 4. This sounds like a big one. Lifestyle choices. What falls under this umbrella, according to the sources?
Yeah, this covers those daily habits that really add up over time. The sources get quite specific. Eating a balanced diet, lots of fruits, veggies, whole grains, lean protein, healthy fats. Regular physical activity aiming for about 30 minutes most days is a common guideline.
The classics.
The classics, exactly. Plus, getting enough sleep, that 7-8 hour target is mentioned. Managing stress effectively, maybe through mindfulness, hobbies, whatever works for you. And crucially, avoiding things known to be harmful. Smoking, drinking alcohol excessively, and too many highly processed foods.
So really the fundamentals of healthy living, sometimes the hardest to stick with consistently, but foundational for prevention, it sounds like.
Absolutely foundational. These habits are powerful medicine in their own right.
Okay, and the 5th and final pillar.
The 5th pillar is mental and emotional health, and it's so important this is included. The sources stress that your mental well-being is just as vital for preventative care as your physical health. They're interconnected.
Definitely. Often gets overlooked in physical health discussions.
It does. So this pillar includes things like practicing mindfulness or meditation, seeking therapy or counseling if you need support, building and maintaining strong social connections, and making time for activities you genuinely enjoy. These things help prevent mental health issues from getting worse and impacting everything else.
So important to see it spelled out like that. Mental health is health. Yeah, those are the 5 pillars. Very clear framework. Now, how do we actually start? The sources offered some practical first steps, right?
Yes, the how to start guidance is really helpful. First step, schedule things. Book those checkups, screenings, and vaccination appointments. Get them on the calendar.
Make it real.
Make it real. Second, start building that healthy routine. Focus on diet, activity, stress, sleep. But don't try to overhaul everything at once. Small, consistent steps.
Small steps. Okay.
Third, set achievable goals. Maybe it's adding one more vegetable serving a day or a 15-minute walk 3 times a week. Something you can actually do. And maybe track your progress that can help with motivation.
Yeah, seeing progress helps.
Definitely. And finally, learn about your family's health history. Knowing if certain conditions run in your family gives you and your doctor valuable information for tailoring your prevention plan.
Those are really solid, actionable steps. It doesn't feel quite so daunting broken down like that. It sounds like it boils down to being consistent, making conscious choices, and really working with your doctor.
That's exactly it. It's not about radical overnight changes that you can't stick with. It's about gradually weaving these proactive habits and check-ins into your life. Partnership is key.
Right. So bringing this all together then, the main message feels like preventative care is really this empowering, proactive way to approach your health long term. It's not just about dodging bullets disease-wise, but actively building up your vitality, your resilience.
Perfectly put. And getting started doesn't mean you need to suddenly become a health saint tomorrow. It's about those consistent, mindful choices day by day and having that ongoing conversation with your healthcare team.
This has been incredibly useful, really clarifying what preventative care means and, importantly, how to make it happen. So, as we wrap up this deep dive, here's something to chew on. Think about your own health, not just as, not being sick, but as this state of energy, of feeling good, of being resilient. And remember that prevention is maybe the most powerful tool you have to protect and nurture that state. So maybe just reflect on one small thing, one tiny step you could take, maybe even today, towards a more preventative approach for your own health. What could that one thing be for you?